We can all agree that mental health is crucial for youth to prosper. And one particular group stands out: college athletics. Our goal is to help college athletics, and this has moved us to bring some issues to the forefront. Why? For one, sports psychologists are not mental health counselors. Athletic programs need to understand this. Additionally, if there are so few mental health care professionals, that means kids can only get limited visits. Indeed, there is dire need for change in the youth mental health state care in higher education. See, with an average of 7,000 students in higher ed, there is usually one counselor to about 1,700 students, which causes a strain on both students and mental health professionals. This causes a great disparity, especially in the athletics program, given that there are 500 athletes on average per school. Due to this challenge, youth consume mental health through other means. For instance, here are how students are coping due to the dated structure. 51% of youth use social media for mental health. 32% use mental health apps. 64% find their resources through Google search. 43% are from word of mouth, with only 13% using professional services. What this means is that schools can't just hire more therapists, as kids are using different mediums to get the help they need. Moreover, the numbers of therapists are few, which would only cause more strain. So what needs to happen and how? This dated structure has led students to turn to tech. Tech offers a new way to begin to address their mental wellness needs. We also need to educate our coaches and admins on mental health aid. Additionally, staff need more data to make efficient, proactive decisions. Finally, there needs to be long-term buy-ins from organization, culture, or it will not work. Keep in mind, tech does not replace humans. It can amplify what the professionals are doing to break the stigma if done right. So here is why the new structure is vital. If we don't improve mental health care in our school systems, there can be extreme consequences. Potential suicide may increase, as we have seen it go up 56% in the last 10 years. Or more students will drop out from college. 64% of students with MH drop out, and many students will resort to substance abuse to cope with issues. Additionally, 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental illness. However, with the new higher education system mental health care the zone is working on, there will be safer spaces, personalized tech, data in aggregate with insights, a student's seat at the mental health care table to talk about their needs. Indeed, the future will look much better for the youth's mental health in higher education.